This video shows how a patient is prepared and draped for a hip replacement surgery using a 3M Bear Hugger upper body warming blanket. The patient is first placed in position on his left side with a safety strap. 2 pillows are placed between the patient's arms and secured with tape. The Bear Hugger upper body warming blanket is unfolded and placed over the patient. The backing covering the adhesive strip is removed so that the Bear Hugger warming blanket can be secured to the patient's skin. Next, the tie strips on the Bear Hugger blanket are tied around the arm board, securing the Bear Hugger blanket in place. The side of the Bear Hugger blanket that will not be used is tucked underneath the surgical table pad. A cotton blanket is laid over the top of the Bear Hugger blanket. A clear drape is positioned over the patient's head. The right ankle is propped up onto a limb holder, and 1 clear plastic drape is applied underneath the right leg and over the top of the left leg. A second clear plastic drape, which extends over the upper body, is applied just above the waist. This drape is also secured to the patient's body with an adhesive strip. Next, the nurse in this video shows where the skin would be disinfected with a surgical skin prep, starting from the incision site and working outward. The right ankle is removed from the limb holder and held while a sterile drape is applied over the left leg. Next, a sterile split sheet is applied over the left leg. This sheet is wrapped up and around the right leg and is secured by an adhesive strip to the patient's waist. A sterile stocking called a stockinette is applied over the right foot and rolled up the leg to just above the knee. A sterile product called Coban self-adhering wrap is wrapped around the right leg, starting with the foot and ending just above the knee. Then a sterile hip drape is unfolded and slid over the right knee and up the right leg. The upper portion of the hip drape is used as an anesthesia screen, with both sides being clipped to IV poles to keep the drape in place. Finally, a sterile Ioban incise drape is placed directly over the intended incision site and is secured to the right hip.